Hi, I'm Dr. Oertle, and welcome to Solidarity's House Call, where we continued this conversation on how to participate in this crusade of healthy living. So today, we're going to be discussing Alzheimer's disease. We all have had loved ones who have suffered with Alzheimer's disease. The current statistics are that 5.8 Americans are dealing with this disease right now. And so we want to be able to figure out what is Alzheimer's, and there's been a lot of research in the recent years on what exactly it is. Current latest research is discussing Alzheimer's as being type 3 diabetes. So what does this mean? Type 2 diabetes is when the insulin is not being utilized well in the body and you have higher levels of sugar floating around in the actual bloodstream. This is what goes on in the brain in later years of life that we've seen contributing to this Alzheimer's presentation. We definitely want to be able to reduce down our glucose levels. The things that are preventing type 2 diabetes are the same things that we can use to be able to help prevent Alzheimer's disease. We've also seen correlations with Alzheimer's disease with infections. Back in 2016, there was a great Spanish researcher who studied Alzheimer's brains. He actually was able to find that out of the 11 Alzheimer's brains that were actually studied, that all 11 of them had multiple fungal infections. He studied 10 non-Alzheimer's brains and found that none of them had fungal infections. And so we see that there's a correlation to fungal infections. This makes sense with high sugar levels in the brain as well. We also have seen in research that Alzheimer's has been correlated not just to fungal infections, but other infections as well, bacterial and viral. And so this is an important aspect. The other thing that's current in research is that there's a specific gene called the ApoE4 gene that about 1/4 of Americans are suffering with. And this is a gene that affects cholesterol levels in the body. This gene allows you to be able to transfer and mobilize fats properly in the body. And we see that there's a strong correlation between individuals that have familial hypercholesterolemia, high cholesterol levels running through the family, and that gene, and we see that it's correlated also to a higher risk of concussions. Other lifestyle things that actually affect risks for Alzheimer's: concussions, high-fat diets, high sugar diets, high carbohydrate diets, being stressed out, not sleeping well, and using sleeping medications. And so things that we can do to be able to help support us, supplement-wise, to be able to prevent Alzheimer's as well, that I've used on my patients are, there's a molecule called PQQ. It's an incredible molecule. You can get it in supplement form. Please ask your doctor before taking. But this has been shown to be able to reduce oxidation of the brain and can really help with that Alzheimer's. The other things are vitamin C, glutathione, and fish oils. But please ask your doctor before taking. Thank you so much. Please join us next time on Solidarity's House Call.